Away from Jigawa, let's talk some health stories. A national state engagement on HIV sustainability has taken place to ensure an effective and efficient disease response driven by local and partner leadership, as well as ownership and financial independence. Experts believe this approach will be one step closer to eliminating HIV by the year 2030. TVC News' Kemi Balogun has more.
Nigeria has made some progress in the HIV and AIDS response through an improvement in testing and treatment services for new infections and mother-to-child transmission of the disease. But experts say more still needs to be done. In 2023, Nigeria still recorded 45,000 new infections. To chart a new course for the HIV response in the country, the issue of sustainability is now on the front burner of discussions here.
We cannot do it alone. It cannot be done at the national level. We have to cascade this down to the state level. And over the years, a lot of parallel structures are in place, for the programs, a lot of vertical programs.
The agenda is to find solutions of improving sustainability and financing, local production of commodities, and also effective data gathering.
So in this conversation, making sure that the political leadership at the state level is important. I'm talking about governors, but I'm also talking about chairman of the LGAs. It is important that we look at our programmatic sustainability, which is ensuring that, so government institutions, the communities are involved in the implementation.
We cannot be talking about ownership and sustainability and importing more than 90% of what we do. The drugs, the reagents, and the test kits, all those things, we must produce condoms. We must try as much as possible to produce them in Nigeria. So that if we are talking about sustainability, then health financing. I look at that financing that health insurance is a key, is the future.
And part of the sustainability is ensuring domestic resource mobilization because, of course, financial program is very essential. Unfortunately, as we speak, most of the funding is driven by donors. But now we are talking about ensuring the necessary budgetary allocation, both at the federal government level, at the state level, and even at the local government level.
Nigeria remains on course to achieve the 2030 target of 95% of Nigerians living with HIV expected to know their status through testing services, 95% of all those with diagnosed HIV infection be captured in sustained antiretroviral therapy, and 95% of all people receiving antiretroviral therapy will have attained viral suppression. Kemi Balogun, TVC News, Abuja.